All right, how are you guys all doing? This is my first recording um, with using this program, so bear with me. But I thought this would be a good tool for us to communicate some information, just a little bit of education. It's hard to get all our practical or skills instructors together in one room, so I figured I'd just do these little snippets of videos talking about certain things that you'll be doing as a practical instructor or a skills instructor. And I'm going to start with our NREMT skill sheet. So we use the National Registry skill sheets inside the program to document whether our students are successful in a skill. And we actually keep this in something that's called a portfolio. And we're required to keep that on file for the student. So that way, when we graduate a student, we can say that they've successfully completed all the requirements of the NREMT, and we have this portfolio on file. So to keep all of that in order, we like using their skill sheets. Okay, so I'm going to kind of go through the skill sheets. So if you're a practical instructor and you're coming to the program and you're going to fill out one of these skill sheets, I'm going to go through it step by step. This happens to be an intramuscular and subcutaneous medication administration skills sheet, and there's all kinds. There's 50 plus different skill sheets that we could be using at any given time in class. But we're going to go through this one specifically. And for the most part, if you understand one, you understand them all. Just little detail changes. So at the top here, it's very important that we have all the information filled in at the top. Sometimes I get these skill sheets back at the end of the night and I'm missing information, and that doesn't make a complete portfolio for the student. So I have to go through and correct that information and make sure it's all filled out, which takes time, and the accuracy could be a problem. So I want to make sure that we have completely filled out evaluation sheets from start to finish, so that we have a good, accurate picture of what the student did that night, and also for the student file that it's correct. So up here at the top, we need the student's name. So if you could just print the student's name and today's date, pretty self-explanatory, but you'll be surprised how often these two pieces of information are missing up at the top. The next thing is the instructor evaluator, or the student evaluator. So sometimes we have students do peer-to-peer evaluations, meaning a student can check another student on their skill. If that's the case, then the student evaluator would sign here. If it's an instructor evaluator, I'd need your instructor signature here. So don't, if you're evaluating a student and you're an instructor, there should be nothing here in the student evaluator. That should be left blank. So you would be signing there. And if you have a signature that is not legible, I can't read your signature, it's important that if you could help me out and just maybe print your name just below that. If you have a pretty legible signature, then I'll know who you are. But it's important because when we add this in FSDAT program, I've got to assign an instructor to that skill. And sometimes I have trouble deciphering your signature, and it makes it inaccurate on what instructor I'm assigning to that skill. The next thing is the scoring. I'm going to scroll this down a little bit. So the scoring here is pretty simple. They simplified this. Instead of going like a 1 through 10, they've kept it pretty simple. It's not applicable, obviously, if it doesn't apply to the patient or to the skill that you're testing them on. 0 meaning they're unsuccessful. They required critical or excessive prompting, inconsistent, and they're not yet competent. They'd get a 0. 1 if they're not yet competent, but they're marginal or inconsistent. This includes some partial attempts. And then 2, successful. They're competent. No prompting necessary. And all these points that you'll give, the 0 or the 1 or 2, you'll see that they add up at the end. So instead of going right down here, I'm going to actually scroll all the way to the bottom, because I think it's sometimes helpful for an instructor to take a look at the critical failures before starting the skills check. So we go down here to the critical criteria, or the critical failures, meaning that if the student gets any of these, 1 or more of these wrong, then regardless of what the total points could be accumulated, it is a fail. So for this sub-QIM admin, the critical criteria, critical failures would be failure to take or verbalize appropriate PPE. That's pretty much on every single NREMT sheet. Failure to identify acceptable injection site. Contaminates equipment or site without appropriately correcting situation. Failure to adequately, failure to adequately dispel air, resulting in the potential for air embolism. failure to aspirate for blood prior to injecting IM medication, injects improper medication or dosage, wrong medication, incorrect amount, administers an inappropriate rate, recaps needles or failure to verbalize disposal of syringe and needle in proper container, failure to observe the patient for desired effect and adverse side effects, failure to manage the patient as a competent EMT, exhibits unacceptable affect with the patient or personnel. So affect is their behavior. So they're inappropriately behaving towards the personnel or the patient, and uses or orders a dangerous or inappropriate intervention, and then failure to receive a total score of 44 or greater on this. So that's your cut score there is 44 on this. Skills are pass-fail. So if we don't have a cut score greater than 44, and then they cannot pass this skill. We fail them on that skill, and they remediate. And then there's comments. Obviously, if there's a critical failure or, positive and negative comments are great, but especially if the student failed, it's very important for us to understand in the remediation, why did that student fail? So some quick comments go a long way in here. That tells me, because most of the time, I don't allow a student that needs to remediate to go back to the same instructor. We would like to set them up with a different instructor. And it's important that we understand where they failed at the first time, and also during that remediation, that learning prescription that we might provide the student after a failed attempt, like, hey, you need to go back and you need to work on these areas. It's important to develop that learning prescription off of these comments. And down here at the bottom is a self-evaluation, and a lot of times this is not filled out, and we need to start getting this filled out. And this is basically the examiner asks the student to reflect on his or her performance and document his or her response to the following questions. So were you successful or unsuccessful in the skill? This is important because sometimes students walk out and they think they were successful and they weren't. We want to identify that so we can help the student understand why they do not understand if they were successful or not. And then it's also important that lots of times that they'll think they're unsuccessful, and most of the time that's probably true. Once in a while they'll just have very low confidence, and we can fix that too. That affective domain we could work on if the student's like, no, I don't think I was successful, and then you as instructor is like, no, you did it great. We need to work on that for a student to gain some confidence. So back up to the top, just want to skip to the bottom there because I think that's a good place to start if you're a practical instructor walking into a room with one of these sheets and you want a quick overview of what's expected out of the students. The actual start time is important, and then an actual end time. Again, these are areas that don't commonly get filled out. These are important because this tells us a little bit about how long did the student take in this area. Did they struggle? Were they at this for 10 minutes? Maybe that's not acceptable. It took you 10 minutes to do a sub-Q injection. It should be much shorter than that. So we would like to document these times. And then it's just check by check here. I'm not going to read every single one of these because the important thing is that all these change for every skill sheet. It's just that this instructor goes line by line. If it's a testing situation, the instructor really doesn't have to communicate other than getting the student started, maybe giving a scenario or some information about the skill and what's expected real quick, and then it just begin. And then you should just be following along with the student silently, scoring them as they go. If they don't do something, then you might score them a 0. If they go back and correct themselves and it was out of order, then you'd probably score them a 1. If they were doing it correctly in order, you'd be scoring them a 2. And you're just going to go line by line all the way through this skill sheet until you get to the end, and you're going to total this up. Put the time ended, total this up. This affective portion is important, right? Does the student accept evaluation and criticism professionally, show willingness to learn, interacts with simulated patient, other personnel in a manner? These are scores too that are very important to us. We found that I don't want to say educating paramedic students is easy. It's not. It's difficult. It's a challenge sometimes, but it seems like psychomotor wise and in the classroom, as far as cognitive domain is concerned, and the psychomotor domain, the hands-on and the learning in the classroom, seems like we can change that behavior quite well. The affective, the behaviors that the students come in with, like professionalism and their ethics and morals, those are difficult to change. So we really want to pay attention to them and work, if there's an issue in here, we want to catch it early so that we can, we can get the student remediated and help them along the way to professionally develop their affective domain, just as important as the other two domains. And then you basically will tell the student, hey, pass fail based on, as long as they didn't have any critical criteria of failures, they had a score greater than 44, their cut score, then, hey, you passed, congratulations, maybe a couple comments. Even though they passed, there could be a couple areas that they need to work on. You could put those comments in there. It'll help the student along the way. And then you want to, basically, I always ask instructors to keep these sheets if it's a testing night, because they're important. They need to get back to me, and it's easier if the instructor hangs on to those and gets them back to me. If it's a teaching night, so we have two, I'll scroll back up the top just so, but we have two types, and this is kind of off topic here, but we have two types of skills nights, okay, where we bring in skill instructors or practical instructors, and we call them both. It's kind of interchangeable word. Whether you're a skill instructor or practical instructor, it's the same thing. So on skills nights, we have two types. We have teaching and we have testing. So if it's a teaching night, I would expect you to utilize these sheets that we provide you, and you're teaching the student. You're going step by step. You can stop the student, you can interject, you help the student along, you give them tips and tricks and all that type of stuff that you can help them along the way. The things that you do out on the street, bring them into the classroom, and as long as they're acceptable and consistent with our education standards, it's okay. Teach them those things. That's important. That's why we have you in the classroom. And then you'll go step by step with this, and you'll, same thing, you probably want to fill these out in teaching nights. I don't need them for the files on teaching nights, but we're going to use these sheets for referencing. On a testing night, okay, or I should say day, I keep saying night because I'm so used to 6 to 10 p.m., but now we're from 9 to 1 p.m., so it's a morning class. But so on the mornings that they're skill labs that they're testing on, then this is a much more hands-off approach. This is just, you're an evaluator, you're evaluating the student, you're not teaching anymore, you're not interjecting, you're not giving them tips or tricks. All of that is over and behind us. We need to know that this student can perform this skill solo. That's very, very important. And if they cannot perform the skill solo per these sheets, then we need to remediate the student. You fail the student, which I know sounds horrible. No instructor wants to fail a student, but it's really not that big of a deal. The students have multiple chances at this. You fail them, they come back to me, and we set up some remediation, right? I work with them. I have another instructor work with them. We at least identified the issue, and then we fix it and get them back out there in the testing environment. So testing nights need to flow quickly, right? We have 35 students now to get through, and usually we only have 6 instructors, so we have to be moving. There's no time on testing nights to teach. It's not a teaching night. There's plenty of time on teaching nights to teach, but testing nights are testing. I hope everyone understands that. So this was kind of the first of many of these little films or movies to come. Hopefully it works out. Hopefully you guys like them. I'm probably just have Stephanie email them out from time to time, and hopefully you take a few minutes. This one was a little lengthy. I hope to keep them much shorter. This one's coming up on close to 14, 15 minutes. So I don't want them that long. I'm trying to keep them about 5 minutes or short, something that I don't lose your attention. Everyone's working, everyone's busy. I don't want to take much of your day. I just want, this one's a little long because there's a little bit of an introduction. So I hope you like it. I hope it works out, and we can continue this. Thanks.